Hi, I'm Dr. Mike. I'm a pharmacist and a pharmacology professor. Today I want to talk to you about how marijuana helps people with seizures. First, in order to understand that, we have to understand how one nerve talks to another. One nerve sends a signal, which is known as a depolarization, to another nerve through what is called a synapse. So they don't actually touch each other. When the depolarization or signal comes down the first nerve fiber and it connects to the next nerve fiber through what's called a synapse, there's a release of what we know as neurotransmitters. Think of these little magnets as neurotransmitters. These neurotransmitters are common throughout the body, and it's cell signaling, nerve cell signaling, and you've heard of some of them like epinephrine, serotonin, dopamine, glutamate, aspartate, GABA, gamma-aminobutyric acid. In fact, the receptors for these little neurotransmitters on the second nerve that's receiving the signal are very common drug targets for drug activity. Not even those receptors, but what the reuptake. So when you think about a selective serotonin reuptake inhibitor, when serotonin comes into the synapse, it's taken back up. And in fact, this process happens so fast, it's just like a wave coming back and forth, except faster than we can think of. Milliseconds is how long it takes. So when all of the serotonin floods, if we can have a drug like a selective serotonin reuptake inhibitor that decreases the ability for this nerve to retake that neurotransmitter back into it, then we increase the concentration of serotonin and therefore increase your happy neurotransmission and it helps depression. That's basically the way an SSRI works. So now that we can see that a nerve signal, a depolarization, comes to a synapse with another nerve, and there's a release of neurotransmitters. It happens very quickly. They're taken back into the presynaptic nerve. That's how one nerve talks to another. So think of this process as a frequency thing. So if you saw my pain video, you understand that the frequency of depolarization from the presynaptic nerve is what our brain uses to determine how much pain we're actually in. So if we go to the central nervous system and we get an overexcitation of presynaptic nerves, and there's a flood of an excitatory neurotransmitter, say namely glutamate, right? Too much of this can result in what we know as a seizure, right? So what do we do when we have somebody who has seizures or is in a seizure? We want to treat them with a medication that's going to do what? It's going to slow down the frequency of this depolarization from the presynaptic nerve, flooding the synaptic cleft with these neurotransmitters, in this case, glutamate, right? There is a common balance between excitatory glutamate and inhibitory GABA or gamma-aminobutyric acid, which coincidentally is the target of benzodiazepines like Valium and Xanax and things like that. So the goal to stop a seizure is to slow down this overexcitation on the presynaptic side. And this is a good depiction of the excitatory versus inhibitory neurotransmission and that balance, that homeostatic balance that's maintained between glutamate and GABA in the central nervous system. Now, I'm very much oversimplifying this, so if you're a doctor or somebody like that and you're watching this, understand this is very much simplified. This is so everybody can kind of get their mind around what a seizure is and how marijuana helps. Enter marijuana. In pharmacy school, I learned about all these neurotransmitters and all these targets of drug activity. But what I did not learn about is any neurotransmitter that goes backwards. Every one I heard about goes from the presynaptic side over to the postsynaptic side, all of the neurotransmitters. Well, since I got into medical marijuana in 2018, I have learned about this homeostatic modulator of marijuana and endocannabinoids. So our body has other neurotransmitters called endocannabinoids. They are 2-AG, which is 2-arachidonoglycerol, and AEA we know of as anandamide. What makes these unique and what makes your endocannabinoid system unique is these neurotransmitters are created on the postsynaptic side. Over here, think of these as neurotransmitters, 2-AG and arachidonoglycerol and AEA. When there is an overexcitation of the presynaptic nerve, these molecules are created on the postsynaptic side and they travel backwards across the synaptic cleft. The wrong way, different than any other neurotransmitter I've ever learned about. Why do they do that? Well, what they do is they go and they bind to their receptors. They're little docking stations on the presynaptic side. They are known as G protein coupled receptors. They're coupled to a G protein that's on the inside of the cell membrane, and they affect the conformation of the ion channels. Now, this depolarization, and you have to think of it not as like one signal, but it's signal, 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 signal. It's fast, fast, fast. The faster it goes, the more intense the signal is. The slower the frequency of depolarization, then the lower the intensity of the signal. So this depolarization depends on ion channels to, quote, repolarize that nerve so that it can depolarize again and send another signal. If we can slow down the rate at which these ion channels work, mess them up so they don't work as good, make them less efficient, then we can slow down the repolarization and thereby slow down the frequency of depolarization and the intensity of that signal. That is what makes the endocannabinoid system unique, and that is the actual target of using marijuana and other cannabinoids to treat seizures. Another depiction of this is pretty well. It shows our presynaptic neuron firing signals and then the creation of AEA and 2AG, where they work backwards, bind at their receptors up here, and then slow down the repolarization ability of the presynaptic nerve. This is exactly how marijuana works to help your pain. And it is also how marijuana works to help a seizure, to help future seizures from happening and to help seizures when they're happening. What do we do? What's our go-to when we have a seizure? It's Diastat. It is a benzodiazepine that's injected rectally because there's excellent absorption there. And it goes through the body very quickly and increases levels of GABA or gamma-aminobutyric acid, which is an inhibitory neurotransmitter. We inhibit the excitatory nerves. And when we use marijuana and cannabinoids in a seizure, basically it is a different pathway to slow down the rate of repolarization, to slow down the frequency of depolarization, and then slow down the overall excitability of that nerve that's causing the seizure, which is, remember, overexcitation and over depolarization. So that is exactly how marijuana helps people with seizures. And I hope this helps you understand a little bit better. Thanks a lot.